Marian and I decided to do something together because there was either mental illness in 30 minutes or complex trauma in 30 minutes. And we decided we'd model team working. And when we tried to think of what we could actually look at in 30 minutes, in an hour that looked at both, trying to stop complex trauma going down to the next generation, and that including maternal mental health, seemed a good crossover. Marian's a GP who works with the Emotional Logic Centre in the UK, and I'm a psychiatrist. So hopefully most of you, when you see this picture, have a wee softening inside. And across the world, people recognise the bond between a mum and a baby as very special and important. The baby comes out, and because it's been listening, just ready to attach, because it's been listening to mum's voice. French and German babies cry in different accents. It's already started recognising mum's voice of others. Its focus is fixed at 20 centimetres, which is the distance from being cradled by mum and seeing her face. And back in the 1920s, there was a belief that scientific upbringing of children would involve minimal touch. And several orphanages in the US tried to do this, but they'd horrendous death rates. This was pre-antibiotics, obviously, and the children just succumbed to infections. That was how important it was to have that attachment. So sometimes that goes wrong. You need a reliable main carer, and if that main carer is addicted to drugs or alcohol, or frequently intoxicated, or is depressed, or can't cope with the baby's changing emotions, then attachment's going to be very difficult. They looked at mums and babies who were securely attached versus not securely attached, and there's a way of testing that I can speak about later if anyone wants to. And both sets of mums guessed right what their baby needed about 40% of the time. What made the difference was that the securely attached mums kept trying. So if this didn't work, they tried that. And in the UK, in the West, we do a lot of things with babies to promote attachment. We spend time looking into their eyes, we do peekaboo, we mimic faces. And all of that builds attachment. Marian, do you fancy asking about the rest of the world?
Yes. So I think we have people in the room there who know a little bit about other cultures, but much more than I do. Some of you may have grown up in other cultures. Some of you may have taught or spent time in other cultures. So any comments or thoughts about how mums relate to babies in other cultures and whether that might be different than the way we do it in our Western culture?
Any comments?
Aye.
Yeah, similar.
Yeah.
They take them to work with them, strap them on their back, and they go and pick rice.
Often continue breastfeeding for a year or two.
Yeah.
Yeah, thank you. I think I'm picking things up. So, so strapping on the back. Of course, I was thinking about the African mums whose babies are carried on their backs, and they are in physical contact with their mums pretty much the whole time, but they're not having facial contact, are they? That
Yeah.
occurred to me. And the breastfeeding for longer period, yes, definitely. That's relevant. Anything else?
I think it depends if your baby is
Really?
normal or not normal. I've seen, for example, in some countries where disabled babies might be more abandoned by families and
Yeah.
just left.
Yes, yes.
And even in the UK, because it's a two-way thing, for example, a child with severe autism isn't going to appear securely attached, and they will be attached, but it might be quite difficult for their mum to actually have a sense of that.
Mm.
And the thing that we keep focusing on is it's good enough care. It's not, it would probably damage a baby if it was perfect care. So nobody has ever met an ambivalent baby. And either things are wonderful or things are appalling. And the newborn just doesn't have anything in between those. With time, if when they're crying, mum comforts the baby, and the cutoff seems to be about 70% of the time. So there is always going to be, no one's going to hit 100%, but the important value looks like about 70%, so 2/3. And that lets the baby know that distress isn't quite as bad as they thought, because you know you can anticipate comfort. Someone's going to come and make it better. By the time you're a toddler, you can do that first bit of self-management by running to your mum to get a cuddle. And throughout childhood, gradually you get more emotionally stable, more able to use memories of being comforted to comfort yourself, more able to cope with small triggers. And then you hit puberty and it all goes for a Burton. But sorry, that might not be Australian English. You fling in a lot of hormones and it all goes badly for a while. But you come out the other end as an adult who has good days and bad days, but who's able to not hurt themselves or other people when they're having those bad days.
Mm.
So it's about being a wee tug in a stormy ocean. Now, next thing we're going to do, hopefully you can see this.
We're seeing a slide here that says what you hope happens to children too. Yes?
Yes. Are you able to see the doll that I'm holding up?
No. Hold on.
Ah,
Hold on. I'll just take it off share screen. Just a sec. I just need to do a Brady Bunch look. Hold on.
I can see the
So, yeah, it's better if I show it like this. Okay.
I'll stop sharing.
No, that's probably easy if you just hold it up. Yeah, we see you now. Yep, we see you, Dolly.
Aye, so baby is screaming her wee heart out. It's not a dirty nappy. It's not hunger. We've tried all the sensible things. what kind of things would you naturally say to the baby when you're trying to persuade it it's not the end of the world?
You have to shout.
It's okay, I'm here with you.
Yes. Did you hear that?
Aye. And keep going.
I love you, it will be all right.
Aye. And
Yeah.
Mummy's here.
Let's aye.
Go outside and look at the puppies or the birds or something.
Yeah.
Sing. Yes, sing, that's right.
Aye. And would any of you say something along the lines of, I know it's not fair. Just a hard life.
Not that age. Not unless something happened to the baby.
Falling over.
Okay, so what you're doing is responding to the fact that the baby has emotions, and you're trying to mirror those back to the baby with the nasty, unfair bit taken out. So you've taken out the toxic bit of the child's emotions, and you're mirroring a very diluted version back to them. So that's the first step in developing emotional understanding, that somebody is understanding yours. If you don't have that, if when you scream, your mum screams back 70% of the time, you don't get that first chance. And if your mum isn't able to comfort you 70% of the time, you never get that chance to start the journey towards coping with your own emotions. And when you don't have that reliable comfort, reliable understanding, you don't just stay at the newborn baby stage. Feeling worse gets more and more serious, and it takes less and less to tip you into it because you're afraid of how bad it is. And if any of you have dealt with looked after children, you're probably aware of that sort of hair trigger temper, either going into anger or going into despair. Now, if you're a bit luckier and your mum does respond like you guys did, in a way that mirrors your emotion and response to them, then the next step is, as a toddler, you start to work out that mum has emotions, and that there's times you want to avoid her and times that you might want to go and cuddle her. And the child starts to be able to predict the mum's response. And if your mum's child begins to predict intentions. If your mum's intention is to make you eat broccoli or put on socks, you're probably going to survive it. If you're in a situation where actually your mum intends to harm you, then you're going to stop learning how to judge intentions, because it's just too scary to go near. And what is very typical of someone with a borderline personality disorder, which generally comes from severe childhood trauma, that about 50% of the time, when they make a guess about what someone's thinking, they're spookily accurate. The other 50%, they're way off and have no ability to tell which one it is. So the first way to what we call complex trauma, so trauma that particularly happens in childhood and can last a long time, and particularly if it comes from caregivers. So failing to start that developmental route is one problem that you can have. The other thing that can happen is that you're developing in a normal way, but then something awful happens. So that could be abuse, bereavement, you're in the middle of a war zone. And the way to survive that is to put your emotions into hibernation. And that's quite effective. But it means that whenever you want to get back in touch with your emotions, you have to go through all the stuff you didn't process and experience at the time, which is enough to make most people keep staying away from connecting with their emotions. And so they develop cognitively, they develop physically, but they don't develop emotionally. And there's times that you can say, yes, the abuse happened at 6 because it's very clear when the development stopped. And like many things, there's a developmental window. If you cover a baby's eye, for 6 weeks, when you take the dressing off, the child's lost sight in the eye. There's other bits of the brain that have just taken over. And the same's true with love. If you haven't had love, reliable love early on, you don't learn how to see it. And because we all automatically believe that love is what our parents do, it means that what you're looking for in a partner can be very dangerous. The horrible experience can also happen in adulthood. So intimate partner violence, getting sent to a labour camp, lots of horrible things that can happen. And what happens there is that you've developed fairly normally, but then these horrendous things happen and they shake all of the rules about the world that you have, about whether you can trust people, about whether awful things are going to happen to you. And it's then very difficult for someone whose worldview has been shaken to relate to the rest of us who are still wearing rose-coloured spectacles when we look around the world, because it's the only way to stay sane amidst the suffering you get in life. So you often end up with someone who feels profoundly isolated from family and from other people in the community who've not been through what they have. So just shouting out, you've got the picture of the mum and the baby. What kind of things could be going on in that picture? Why would the mum be behaving like that?
Shout out.
Postpartum depression.
So speak up.
Postpartum depression.
Postpartum depression.
Good. Any other ones?
Substance abuse or addiction.
Yep.
Substance abuse. You can hear. Tell me if you can't hear.
I can hear.
I'm sorry,
Thank
I
you.
can't hear very well.
In some cultures, maybe a third or a fourth girl baby.
Third or fourth
Yeah.
girl baby in some cultures. I'll repeat it for you, Marian.
Thank you.
Deserted by partner or family members.
Yeah. So there's an awful lot of things that could be going on. And we sometimes talk about ghosts in the nursery, particularly when someone has had early experiences of very poor parenting, early neglect, early abuse. And of course, both of those make addiction or postnatal depression much more likely. So you've got the two things coming in at the same time. So when instinctive parenting is doing what was done to you, and most of the time that works pretty well. If you've had a horrendous childhood, then a lot of different things can be difficult. So tuning into the baby, remembering the feelings that you had, which aren't available consciously, but when you see someone using the same endearments to a baby that were used with them, that's part of what's happening. But you can't tune in if that was a horribly abusive time that you can't think about. Obviously, there's a risk that you repeat how your parents parented you because you don't have another pattern. You can begin to relate to this crying, demanding child as someone trying to abuse you. And as we said at the start, you're much more likely to have addiction or mental illness. And you're also more likely to have abandonment and problems with your family because of those difficulties with relationships that we've talked about.
Okay, so this is something that may seem a little different, but you will see how it interacts. So when Jenny was talking about these people they've missed things in their early childhood that were essentials for them, essentials for thriving, like love or security or safety or an emotionally available adult. Basically, they're grieving those things. And it says at the top of this that grief is godly, and we will be looking a bit more at that. But all of these grief emotions are actually God-given, and a baby will experience these emotions. Now, they feel very uncomfortable, but they're supposed to, because we're supposed to move quickly through them. Now, these 7 emotions here were described by the British Hospice movement as the 7 stages of grief. And they were looking at somebody who'd been bereaved. So it was fairly simple, one loss, massive loss, and they looked at the stages that the person went through. But what we're talking about here with this complex trauma is multiple losses happening over a period of time in a child who's not yet neurologically developed. Everything gets tangled up together and nothing is processed logically or tidily. And in fact, we as human beings, even as adults, don't process our losses tidily and logically like this because we're humans and not robots. But certainly in the situation of childhood complex trauma, we don't process it like this. But it's useful to know that these emotions are there and what can happen that can make things difficult. So Jenny has talked about the child putting their emotions in hibernation, as she put it. Now, we might say that what they're doing is they're so shocked at the beginning there, they're so unable to work out what they can do about something. Of course, a baby is totally incapable of doing anything about anything, aren't they? They're completely powerless. So what they have to do is put it into denial. So let's just pretend it's not happening. And that can become a habit that carries on and on and on into adult life. Anytime something happens, we'll just put it into the denial freezer, if you like. And the freezer gets really full up. And it's using energy all the time to keep it frozen. So that's one sort of thing that can happen. Another sort of thing that can happen is that everything can stack up on one of these emotions. Guilt, anger, for example, could be a common one, that they get as far as that and then everything stacks up there. And this can lead to behaviors that are difficult for us to understand and difficult for us to cope with. But nonetheless, if you look behind the emotion, look behind the behavior to the emotion and behind the emotion to what the losses are, that's what trauma-informed practice is. So a child who's still got undeveloped neurological pathways, as Jenny was saying, will particularly get stuck in this grief process, and it will look like something different. So Jenny's already mentioned borderline personality disorder, but many other mental health or even criminal activities and behaviors actually relate back to what was going on when somebody was growing up. So multiple, complex, ongoing traumatic grief leads to really difficult things that are difficult to understand. Can we have the next slide?
I think you guys are running it.
Pardon?
It's all right.
Okay, yeah. So this is talking about whirlpools. Now, this is when more than one of those healthy grief emotions gets tangled up together. And the writing there says it's the troubled inner heart behind mental illness and socially disruptive behavior. So this is what happens when people get lost emotions that they cannot process logically and tidily, and they get mixed up together. So if two or more of those healthy emotions get tied up together, it feels like something completely different and makes people totally stuck. So before we move to the next slide, just like you to do an activity a minute. I'd like you to all imagine that I've just said something totally shocking, sent you into shock. What body language and facial expression might you have if something shocking has happened? Just do that. Just do the facial expression and the body language just for a second, okay? Do it now.
Can you see it?
You see us?
Yep, thank you. Excellent. Now, just imagine that I'm making you really angry. I've said something that's really upset you and made you cross. Do the facial expression and body language that you might have if you're feeling really angry, just for a second. Lovely. Thank you. Now do both of those together, okay? Is that possible? How did that feel?
Odd.
Odd, yes. Any other words?
Possible.
Weird
Impossible.
and odd.
That was
Impossible, yeah. Okay, thanks, Jenny. Can you move on? So you've just experienced a whirlpool. You didn't have the emotions, but when we do the body language and the facial expression of an emotion, we start to feel that emotion because our emotions are physical. So this is what you were experiencing, shock and anger tied up together. And interestingly, we notice here that people feel odd and out of it and confused, unable to think clearly, and distanced from life and depersonalized. So some of those words that you used are reflected there in that description of that whirlpool. Okay, can we go on? Here are a few more whirlpools. Now, just something general about whirlpools. These were discovered empirically, actually in general practice, in UK family medicine, in the days when a doctor could talk to the patients at length. And patients would come in complaining of different behaviors or symptom complexes, and the doctor would look behind and say, well, you've got a lot going on in life, haven't you, at the moment? So let's think, what's been going on for you? What losses have you had? And let's see what emotions are happening. And discovered that people with different behaviors had lots and lots of one emotion and lots and lots of another emotion tied up together. This is a very brief overview. But so these were found empirically. And shame at the top there, which is shock and guilt felt together, is really important when we're talking about childhood trauma. Because I would say that, I don't know what Jenny would say, but I would say that all children and even adults that have been through massive trauma, who are left with baggage from it, experience shame. They're shocked because there's nothing they can do about it. They haven't got the resources to cope with it. And being a child, everything is about them. When we're young children, we don't perceive that other people have any agency. If something's going on, then it must be our fault. So those two get tied up together. And that can carry on into adulthood. These other two are also very relevant here. Low self-regard, when guilt and depression get tied up together, leads to clinical depression. And the bottom one, the destructive behavior one, is a really important one when we think about trauma-informed practice. And in the UK, the criminal justice system was onto this much quicker than healthcare has been. When somebody is acting out in a violent way, they're being confrontational, maybe they're being suicidal, look behind the behavior to the emotions, and behind the emotions to the losses. And these people usually have anger mixed up with depression. They're powerless. They've got that useful, in its uncomplicated sense, that useful emotion of realizing that they have limits and that they're not superhuman, as we were hearing when we were hearing about the resilience talk. But unfortunately, it's tied up with a drive to do something to change it that is so powerful that it can lead to, got to change something, and I can't change the thing that I want to change, so I'll just change something else. And it doesn't matter what it is. So that's another whirlpool. Thanks, Jenny. Ooh, other way. Sorry, you're muted, Jenny.
Thanks, Marian. That would have been a problem. Aye. So the next question, going back to that mum who's struggling with the baby, whatever whirlpool she's going to, is how can we help? And Marian and I each have our own slide in this. In terms of practical support, being good neighbours, going in and helping, or saying, do you want to come to my house? And the baby can still scream, but at least you'll be somewhere else with the baby screaming. if the mum isn't able to play with the baby, then someone else playing still helps. There was a study I was told about in medical school where sub-Saharan Africa, a research trial gave one set of mums a 1,000-calorie biscuit to help with breastfeeding. One set of mums, a volunteer, came in and played with the baby, and there were a couple of others. But the children who'd been played with improved as much as the children whose mum had had that 1,000-calorie biscuit. It's really important for wee ones developing. There's techniques like you can film the mum's interaction on your phone. Find any bit that's positive and say, look how good that was when you did this. Do you see that? Do you see how the wee one reacted? Sometimes folk need help to know what's not normal and not normal in a baby, like being selfish is entirely usual. And getting out the house, things like baby massage is entirely about getting people out the house, meeting other mums, and hopefully having a nice, positive experience with a baby. And if somebody is depressed, then giving them antidepressants if it's severe enough. And if the child's slightly older, other people building relationships with the child will help. And if the problem's ongoing trauma, then you're much more into building relationships with the child, plus or minus social services. Sorry, the screen is deciding it doesn't want to play.
Thank you. So 3 things have been shown to break this negative cycle with a traumatized upbringing. One is to feel truly heard. So we already heard, didn't we, about the idea of giving somebody a jolly good listening to, according to Chris Johnston. Well, there we go. Here it is again. Really listen and show them that you're not only listening, but you're hearing them, which is a different thing. Having an emotionally available person. Well, as a child, as Jenny was saying, if the child's got ongoing trauma, then having at least one emotionally available person, emotionally available adult to relate to. And for a child that's not getting that at home, that might be the youth club leader or a teacher or somebody, but they need one that is emotionally available. And then the third thing is being able to let go of the shame, that whirlpool that we mentioned, of being, helped to see that actually it's not all their fault, and that the shock can be useful to help them find a safe place. So this emotionally available person becomes their safe place. But this complex trauma we recognize as hardwired grief. So hardwired because it was occurring before the neurological pathways were complete. And it gets wired into the neurological pathways, which is why it's not easy to improve it once people become adults. It's possible. I'm hopeful. I think we have to be hopeful that it is, but it's hard. But trauma-informed practice says, again, look behind the behavior to the emotions and behind those to the losses. And here's some of the things that can cause those traumas. And you don't need to read all of them because I'm sure you know them, but there are lots. And of course, we should add the COVID-19 pandemic to this as well, because certainly children who experienced all the isolation of that have had another adverse childhood experience added to the list. Can I have the next one? So we know that adverse childhood experiences, or ACEs as they get called, have effects, some of which are very easy to see and other effects which are difficult to follow on. But all of those things, depression, and injuries, unintended pregnancies and sexually transmitted diseases, cancer and diabetes and chronic disease. Interesting, isn't it? To think how much of our physical health is actually related to our emotional health, how dependent our physical health is on our emotional health. And then not failing at school, leading on to lower economic status, etc., etc. And people who have 6+ adverse childhood experiences are at risk of dying 20 years earlier than people who've had none or very few. So it's a really important area. Thanks. So we've talked about this hardwired grief causing people to react in unusual ways as far as somebody else is concerned. But then we talk about the safe place that was lacking in childhood and how we can be safe places for people, which will allow them to let that shock settle down and help them to make a smart plan to recover. And that can lead to post-traumatic growth. So all of us know people who've been through really difficult things, or can think of people, you can move on, Jenny, thanks, who've been through really difficult things and have come through the other side stronger. You know, we all know of people who've have had, you know, been in books written about them who've come through awful things that you wouldn't wish on anybody, but come through the other side as stronger people. And that's what can happen when we find a way through this grief process, by understanding it better and by having somebody to help us to get something back. And let's go to the final slide because our time's nearly gone. No, not quite final slide. Do you want to do this one?
We've got an extra bit, but I'll check that with Patrina.
It's okay.
So 12 out of 13 parents who were abused didn't abuse their own children. And that's a really important statistic to hold on to, because it can feel like you've got these ill omens, and because you have them, that means you can't be a good parent. And it doesn't. The majority of folk do significantly better than their parents did. We all struggle, and that's a starting place. We can help, and as healthcare professionals, stuff that we do can help reduce the amount of trauma that gets handed on. And up to 70% of people come through traumatic events stronger. So in terms of stopping new cycle starting, the commonest way for that complex trauma to start, if it's not been handed down, is that either maternal mental health problems, or can also be physical, could also be abusive partner. But mental illness is a very good way to start a new cycle, generational cycle. And there are very varying prevalence estimates about how many people internationally experience postnatal depression and anxiety. Almost 20% is one of the higher estimates, including with and that's taken from a high income setting. In the West, the biggest risk factor for having postnatal depression is a personal or family history of mental illness. In low middle income settings, it's social stress. And a lot of the things that people were shouting out when we were asking what could be wrong with the mum, poverty, not being married or being abandoned, domestic violence, in a lot of areas, you live with your in-laws, and hostile in-laws are an enormous problem. And they only become more hostile if, like someone suggested earlier, this is a third or fourth girl child. And the prevalence in surveys varies a lot over the world. But when you look at cultures, they have concepts that they may or may not see as mental illness that fit with what we think of as postnatal depression. So in South Africa, people who have significant stress after the birth of baby because they don't have a husband, because of poverty, are seen as thinking too much, which goes along with social withdrawal, goes along with anxiety and altered behaviour. In India, it's nerves caused by husband and in-laws, and other factors like whether you're working, whether the baby is a boy or a girl. In the Arab states, it's seen as Jinn possession. But if you look at the list of symptoms, anxious, sad, guilty, tired, hopeless, struggling to cope with the baby, then again, it fits very well with what we understand as postnatal depression. And I'm going to talk about medicine. That's because there's not much evidence on psychological treatment being effective in low middle income country settings. So if you're in the West, then you give someone sertraline. They take it just before the baby's, you express prior to the baby's longest nap. You then take the tablet, and when the baby wakes up, you give the baby the expressed milk and discard what you got, the milk that's been building up in your breast while the baby was sleeping. And with sertraline, you probably don't even need to do that, because it's not been found in detectable levels in the baby's blood. Unfortunately, low middle income settings, the chances are much higher that you only have fluoxetine. And that's a medication that does get into the blood. It's because it's got a very long half-life. And the baby can get GI side effects, so the baby can get diarrhea and things, but there doesn't seem to be any neurodevelopmental effects. And of course, depending on where you are and how hard it is to get hold of clean water, you're going to have to think quite carefully about the benefits of breastfeeding versus formula versus SSRI exposure. And of course, all of that, the one thing you really want for the baby is to have a well mum. And the evidence is that the effect of having a mum with postnatal depression is higher in low resource settings. They think probably just because there's so much more you need to do to protect a baby there. And the thing you really want to avoid is a sedating medicine, because babies need to be alert and developing in the right windows, developmental windows. So coming back to Marian for the final slide.
So I was talking earlier on about grief and saying grief is godly, and just wanting to point you to a few scriptures and biblical ideas here to fill that out. So we know that God grieves. God grieves for the world. He grieves for us. He grieves for that relationship that he hoped to have with mankind. And we hear in Genesis 6:6 that the Lord was grieved that he'd made man on the earth. Jesus, of course, was a man of sorrows and acquainted with grief. And he also said, "Blessed are those who mourn, for they will be comforted." We can do Bible studies showing that Jesus in his humanity experienced all the grief emotions that we have been talking about. And they're unpleasant, but they're like that because we're supposed to move through the process, which is a God-given process. We just need to activate. Thank you.